Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. Hello and welcome to the Medical Sales Podcast. So last week we sat with Carlos Gregory and we discussed private equity and how it plays into the medical device space. It was one of our longer episodes, going about an hour. This week we're actually bringing to you part 2 of that discussion. Last week we had part 1 and 2 in the same segment. And this week's going to be the second half of that conversation. So for all of you that might not have been able to make it to the end of the episode, this is the last segment, the second half of that interview. So take a listen. We talk about the product that they're bringing to the market and how they're revolutionizing COVID-19 management. And thanks again for listening to the Medical Sales Podcast. Okay, so let's talk about your company. Let's talk about what you guys are doing. And, you know, what I like and what I found interesting, and the reason why I wanted you guys on is because you guys are, well, you know what, let me let you explain it. Explain your company, and then I'll get into some more questions.
Yeah, so this company, JR Bio, is a company that is distributing a Medisystem. So Medisystem, what is it? Basically, it's a whole room disinfection device. And it was originally designed for operating rooms. I think we all know that hospital-borne illnesses are a billion-dollar problem, and there's a lot of evidence behind the aerolization of hydrogen peroxide as a method to disinfect a space, and there's proof that it actually reduces the hospital-borne illnesses by 70%. Right, so that's a big dollar figure when you're talking about billions of dollars.
Yes.
So it was originally designed to solve for that problem, and the founders, the inventor of the company or of the device, Medisystem, was focused wholly on that. We looked at it and said, there's an opportunity here with what's going on with COVID. There's an opportunity here with the inventor, founder, and the marketing and the business plan. We know a lot of folks in government and the healthcare industry, and in really, many other industries that we think could benefit from this product. And why? I think that what we're seeing today isn't going away anytime soon as far as the disinfection of facilities and spaces. I think it's something that we're going to slowly grow into. And when you have a product that's been already proven, we have some of the most important infectious institutions in Italy that support the product. We have the Jackson Memorial Hospital out of Miami, which is, I think one of the top 5 largest hospitals in the entire country, where we've had some trials completed and it's proven to be very successful. So when you have something that's already been proven and can have this type of impact on society, I think it's a great combination for us. So, in simple terms, what it does is it aerolizes and micronebulizes a hydrogen peroxide silver sulfate solution, which is proprietary as well, into the air, like if you're blowing into a balloon. So imagine your office there, needing a disinfection treatment. We would come in, we would measure the space, height, width, and the length to get the volume. And then the user interface of the device allows us to plug in that volume, and it knows exactly how much of the Evolysse, which is the name of the solution, it needs to deploy into the air in order to completely disinfect your space. So I plug in the volume, I press start, I walk out, and then when I come back, I open the door, and there's no need to do anything else. It's dry, there's nothing wet, there's no residue, I don't have to wipe anything down. I walk into the space, I take away my Medisystem, and you're ready to walk back into a completely disinfected room.
Wow. How long does it take? I mean, of course, guys, but maybe a cafeteria. Think of your school gym cafeteria.
Yeah, a school gym cafeteria would take, let's see. Well, I know we just did a classroom the other day. It's roughly 9,000 cubic feet. And I think it takes something like 7 minutes.
7 minutes. Wait a minute. So this device, you just walk into a relatively large room, you put it down, you plug in the size of the area, you walk out and come back 7 minutes later, and it is 100% good to go.
Yeah, there's some dwell time, right? After it deploys the chemical, the solution into the air, there's some dwell time, but it's fast. It's fast, right? Here's the comparison.
Yeah.
So the comparison is, okay, let's say that I am the best professional cleaning company in the world.
Sure.
Right? And I have trained my people, and every single one of my people, they're robots. They all do it exactly the same way, perfectly.
Yep.
Right? They get a chemical. This is typically how it works. They get a chemical that has to be diluted in water.
Mm-hmm.
Right? So they're mixing it on their own, but they mix it perfectly every single time.
Sure.
And then when they go into the space, they're going to wipe down every surface. Every single surface. I mean, think of your office. You got a microphone in front of you. You got the cables coming out of the back of your computer. You got the blinds on your windows. You got every book. You got your bookshelf. You have the ceiling, maybe carpet, the walls, paintings on the walls, every single surface. They wipe it down perfectly. And they do it every room in your house or in your office the same way. Then, how do they disinfect the air? They can't. They're in there, right? And so that's where this is so amazing, because number one, that person and that company, they don't exist. And if they did exist, the time it would take that individual to clean every single surface and do it the exact same way, nobody would pay for that, right? So that's the difference. It's taking the person that's really kind of wiping down all the surfaces, or as we hear a lot about today, the high touch areas,
Mm-hmm.
right? They're doing the best they can. Maybe they diluted the chemicals right that day. They were having a good day.
Mm-hmm.
They're in and out there as quickly as they possibly can be, right? Because their bosses are telling them time is money. And so you have a partially disinfected room.
You could not have a more appropriate product for this day and age.
It's unbelievable.
Wow. So, I mean, hotels and airlines are the first things that come to mind. I'm assuming you guys already capitalized on that industry, on those industries.
Heavily. We are working with a lot of the homeowners associations. We're working with hotel and lodging associations. We're having some really, really high level conversations now with a couple of airlines where we're actually doing tests, right? Some of them have asked us to actually prove it inside of an airplane,
right?
Because that's the other part of it, right? Some of the stuff that's on the market today is wetting in order to disinfect. And, you think about the electronics inside of an airplane, you can't wet that, right? Maybe you can, but if you do it too much, corrosion, these things start to happen. And that's where, we've heard a little bit on the news about, okay, airplanes are going to use UV lights because it doesn't wet anything. Mm-hmm. But just think about for a minute how much shade there is in an airplane.
Right.
The UV light trying to go down the aisle.
Yeah.
So, that, I think that fad will pass. And that's the unique thing about our device and our solution and our process, and is that the Medisystem leaves no residue. So all of those electronics are safe. We also have food packing warehouses. So it's food safe.
It's food safe. So this can get on the meat.
This can get on the meat.
It's kind of hard to believe. So how, so in the pharmaceutical space, it's all about white paper. It's all about what's been clinically proven.
That's right.
In the device space, it's not much different. So how has this been proven? What trials or what tests have been done that allow you guys to have this kind of confidence and go in there and say, let's see.
Yeah. We have 15 plus trial reports on the Medisystem itself. since 2015 that have been conducted internationally and locally here in the United States by some of the most prestigious hospitals and infectious pathogen institutions, where the product has been proven to do as it was intended. And then Evolysse, the actual solution, came first. So, there's a lot of studies behind the chemical compounds in it, the hydrogen peroxide silver-sulfate mixture, and how that's practical for use in disinfection, used in an aerolized or micronebulized disinfection process. So we have tons of information. It's funny you mentioned that because, I want to go back to a comment that you just made, like, it's hard to believe. That is the most common reaction that we get when we're presenting the product.
I can only imagine.
It's first like, prove it, right, followed by, why doesn't everybody know about this?
Right. And that's funny because I was going to go that direction as well. So let me ask you this: how do you prove it when you're out there in the field and you're trying to make the case for a potential customer to use this product?
Yeah. So, the greatest thing that we have is that our device is registered as a Class 1 medical device with the FDA. And that's not easy to do, right? In order to accomplish that, you have to be able to show that you have, trial reports that are sufficient to prove that your device is not going to be, number one, harmful to humans, right? And number two, that, the process itself has enough support by, the medical community that this is, your device, and this is exactly how your device works, and all of those things. So, I'd say that's kind of the first thing that we point at. And people understand that, right? People that, are in this space, particularly in healthcare or pharmaceuticals, they understand the weight that the FDA carries, and they understand that, those things don't happen overnight, right? You just don't submit an application and they register your device.
By the FDA, right.
So that's the first one. Then, once you're looking at other industries, and even in some healthcare and some hospitals, for example, in the hospitals, you're talking to a chief medical officer, and they don't even want to see it until you show them the clinicals, the trial reports, right?
Right.
And so we obviously, graciously provide that, which obviously is fun, because when they call you back, they're like, why doesn't anybody know about this? Right. And then, when you get outside of that healthcare industry and using that terminology into like a hospitality industry, I can talk to them about the FDA and trial reports and efficacy all day long. And, it's like a deer in headlights whatsoever, right?
And
so in a couple of scenarios, we, depending on, the size of the opportunity, but one recently, which was, I think they have 7 or 8 plus resorts that have 1,000 units or more. We actually conducted a lab test inside of one of their rooms, one of their villas, after the company that they're currently using had disinfected it.
Sure.
And so we do before our treatment and after treatment. That gets sent out to a third-party lab, and then we present the results to them. And as you can imagine, it's
That's fascinating. So right now, where are you? What's your biggest target right now? Are you targeting is it hospitals right now? Is it airlines? Is it hotels? Who are you mostly focused on right now?
Yeah, as an organization, we're focused in 3 sectors, right? We're focused in healthcare, government, and the restoration space, right? Think of like ServPro and those types of companies. Healthcare, one, because they're obviously being heavily impacted by COVID. Pretty much all of the first responders, whether it's helicopter ambulances or regular ambulances, or your first responders coming out of fire stations that are carrying COVID positive patients inside of those vehicles, and then taking them to the COVID floor of the hospital. Yeah. Obviously they have an urgent and immediate need for, this type of disinfection. Okay. So we have a lot of focus there. Government, and when you think of government, we think of obviously the VA, and then a lot of the bases that have their own kind of, nursing facilities and smaller clinical facilities where I mean, you know, COVID is active. And then you also have sorry, sounds like someone's trying to knock my house down. So inside of the government, you have those facilities, and then in the restoration space, you know, we're seeing a lot of, hey, you know, my staff member contracted COVID, and now 3 of them have it. I have to shut down my business while they go and get tested and quarantine and do all these things. But if some of them come back that they were negative, you know, what do I do, right? So that space can be disinfected. The Medisystem certifies its process. The actual machine, the device, provides a certificate that you download onto a USB, and so that gives comfort to the owner of the business, or the manager, or the supervisor, or whoever it is, the director, to be able to tell the team, hey, you know, if you're tested negative, it's okay to come back. We just had the space, you know, certified, and obviously for customers as well. To come back in if that's the type of business that it is. So those are the 3 areas that we're spending a lot of energy on. And, you know, I think the government side and healthcare, those are 2 very ambitious spaces to be going after. But again, fortunately, because of the network that we have and the sales professionals that we look for, we already have connectivity into that space. And then it's just a matter of getting into the right presentations with the right folks, and then putting those proposals together to get the decisions done.
Right. And what happens if someone gets stuck in a room where this device starts working? Is it dangerous for someone to breathe in and be around? Is it, how is that managed, or is that something that's even managed?
No, you know, obviously the preference is for nobody to be in there. If somebody is in the space, then, you know, you want to make sure that you're wearing PPE, right? The proper PPE.
Sure.
In the absolute worst case scenario, you get stuck in there with 0 PPE, and you know, the device goes off. I mean, I'm sure you're going to get out of there pretty quickly, but you know, you'll smell it, right? Sure. You know, and usually when you go in after a treatment, you know, the most common is it smells like a hospital room.
Interesting.
Yeah, but yes, it's, you know, obviously it's completely safe. It's really hydrogen peroxide is the active ingredient inside of it. It's at a little bit stronger level and at a quality that's not what you and I would buy at, you know, the pharmacy. But it's completely safe.
So even if, I mean, it gets on food. So
right,
if it can get on food, and I guess after a certain amount of time, you can touch that food and you don't have to worry about it. If you walk in right after a treatment, you can touch the surfaces and you don't have to really be worried about, you know, any danger to you or your skin.
Yes, absolutely. And I think that's, you know, that's one of the great things about it, is that it's not some Clorox based or chlorine based chemical compound that is very, very damaging, not only to the environment, but also to humans and material things and electronics. It's hydrogen peroxide. I mean, it's been around forever, right? We put this stuff on our kids when they, you know, get a bloody knee from falling down.
That is amazing. I love what you guys are doing. And right now, you guys are actually growing. This is happening right now. So you're looking for sales reps to continue to make this happen and get to the point where everybody does know about this.
Yeah, and that's our goal. You know, we want to continue to build out our team of sales professionals. You know, we have identified a couple of the major metros throughout the United States that we're focusing on right now and filling roles, you know, to bring the product to market there locally. But we want to make sure that we identify with the right people, you know, folks that have some medical device or healthcare related training, or some really, really technical type of sales positions that have a proven record of being successful in sales. And that, you know, that are more than just about getting the deal done, that they really want to have a relationship with their customer, right? And I think that's a really important part and a non-negotiable. We're not looking for the sales professional who's just, hey, I sold it and I'll see you later. Right. We're looking for the sales professional who's like, I sold it, and then they're following up and, you know, how can I help? And all of those things to make sure that they're using the product consistently And obviously that turns into referrals, and really we've organized the compensation package for sales professionals to align with that mentality.
Relationship development mentality.
Yes.
That's huge. So I got to ask, how did you discover the company that makes this device? Or is it the person that makes this device? What happened?
Yeah. So, another person, old friend of mine that I helped start a business, I don't know, maybe 10, 12 years ago. His business was severely impacted by COVID. And as a result of that, over the years, he had obviously made a lot of friends in the hygiene space, and remembered that somebody had told him about something like this. Mm-hmm. And we looked into it together, and he presented it to me, and I said, hey, this is something we'd like to invest in and get behind, and let's go. And so, thanks to COVID, we've had this opportunity, and it's been, incredible. So far, so good.
That's amazing. And from that conversation till today, how long has it been?
Wow. So we had that conversation, I want to say in March, April. And then that's, I would say March, jumped into due diligence in April. April, May, June, July 1st was when everything was kind of formalized. Uh-huh. And so, July 1st to now.
You guys have been generating quite a bit of revenue. I mean, things have been happening fast.
Things have been happening fast. I mean, very, very fast. But it's great. Listen, it's exciting. We, 14 sales professionals now. We're and then two of our sales professionals are starting to build out teams in their markets.
Wow.
So, we're looking at those folks, but we continue to interview. We want to grow. We want to get the right people. We want to get it out to the market. We want to create problems for some of these big companies, and solve problems for a lot of folks who need it. So it's fun. I'm having a blast. I think that, from a cultural standpoint, we are a very faith-based company. So integrity is important. And I'd say the other thing is just, we just work hard, right? We work smart, we work hard. We know that in order to reach our goals, we have to pursue them on a daily basis and persevere and have the right mentality and help each other, right? Work for each other as another guiding principle.
That's excellent. So for our audience that's listening, what would you share with them? I mean, I know that our listenership, we have people that are in pharmaceutical companies, medical device companies, genetic testing companies, anything related to medicine and sales. They're in there, from the sales rep all the way to the directors, to VPs and CEOs. What would you like to share as far as what you're looking for in your company, and anything else you'd like to share with the audience?
Yeah, I think first and foremost, personally, I'd like to share that anything that I can do for anyone to help them grow or to connect them with people that are inside of my network, I'd be happy and honored to do so, right? And anybody that's connected to your show, Samuel, and that I can help grow or connect with the right folks in whatever way makes sense for them, or even just to have a conversation about what they're doing, it would be my pleasure. And then, as far as the company goes, JR Bio and the Medisystem, I'd say, just look out and feel free to contact me if you want to learn more about it. We're very excited. We're incredibly bullish on the opportunity that we're dealing with. Everything that's happening in the market today, not only for ourselves, but for some of our competitors, tells us that the runway that we have is very, very long, and we're just at the beginning of it. And so the growth potential with our company is significant. And if, you're someone who is a go-getter, who has a good track record in sales and is maybe looking to make a change into something that's a little bit different, please feel free to reach out, right? We're looking for the right individuals right now to continue to grow our sales team and have, a greater impact nationally. I think that's the other thing that's great about the project. It's something that has a real impact in people's lives. And we believe it's one of the key reasons why we've been so fortunate in winning business and reaching the level that we have so far. So, just here to help and support and others and whatever endeavors they have, and looking for the right people to get out there and help us grow.
That's excellent. Well, Carlos, this is fascinating. I can't wait to see where you guys take things. I'm going to be keeping a definite pulse, and we probably have to do a follow-up so you can tell us how much this has exploded in the next few months, maybe 6-7 months or something.
That's a great idea.
Excellent. Well, thanks for being on the show, and we'll be talking to you soon.
Awesome. Thanks, Samuel. Thanks for having us.
Definitely.
Now, I dare you to tell me that wasn't an interesting episode. That's a pretty fascinating product. To be able to step into an environment that had COVID, set up a device, leave, come back 7 minutes later, and not only have it COVID-free, but have a dry environment, that's impressive stuff. And I have nothing but high expectations for how far they're going to take this product. But the episode was great. I mean, we learned quite a bit, right? We learned the value that a sales rep can find in working for a startup, and how private equity plays such an important piece in the value proposition a sales rep that's considering working in a startup can have. We learned about how private equity really, even though they are focused on the numbers and they want to get as much valuation out of that company as possible, there's a lot of private equity firms out there that are very intentional with making sure the service and the product and what it's doing for its customers is not compromised. Today, we got to hear from an example of that and how focused they are on making sure the customer experience is everything that it should be, as well as growing the company and allowing everyone that works within the organization to reach their highest potential. And I love some of the things we talked about, right? I mean, what must a company have that will even allow a private equity firm like Carlos's private equity firm? What do they have to have going on to even be considered to be backed? And right off the bat, he said, highly ethical. The product or service is proven. Customer base is well established. And I love this, a management team that lives, breathes, and dreams about the company. And those are the true movers and shakers of the world, right? The companies that go the extra mile to make sure they're really contributing to making a big impact in this world. And then he ended it with, believe they have the network to truly help them grow. So, they take on a level of risk themselves, like any private equity firm. But I like how Carlos delivered that, because it's very important to them that they see that their resources can help to the nth degree with any company they choose to work with. And you also got to see the kind of work ethic that Carlos puts into what he's doing now with this new opportunity with Jar Bio. I mean, I couldn't believe it when I heard what they're working on. And just like he said in the interview, he gets that a lot from new customers that are just completely dumbfounded on how the whole world isn't using this left and right. And, honestly, they will be. They're new, so they got to get the word out, right? But it's pretty exciting. And if anyone out there wants to get a new opportunity, or they've been looking for an opportunity and they're trying to get their foot in the door, or maybe they're even leaving from a previous medical device or pharmaceutical company or biotech company, and they want to do something different, I mean, this is an excellent opportunity to consider. It really is. And they have a phenomenal product with a phenomenal company, and of course, some phenomenal backing. So again, thank you for listening to this episode. It's our first episode of the year, so I'm so excited to bring it to you. And don't forget, I'm going to say it because it's critically important. It is 2021. It is a brand new year, which means a brand new start for all of us, especially for you. And if you're someone out there that's looking for that brand new start in a brand new role with a brand new company, specifically medical sales, then you need to make sure you take our assessment. You can go to evolveyoursuccess.com and take the assessment. You can find us on LinkedIn. You can find us on Instagram. You can find us on Facebook. Take the assessment. Get some clarity into this thing that you want so badly, right? You want to get into this role. You want to make something happen. You want your life and your career trajectory to look completely different. So learn what you need to have to get the job you actually want. And this doesn't just go for those of you that have no experience in the industry. If you were displaced, or if you left, or if you were laid off, or if you just want something different, again, you need to visit evolveyoursuccess.com and take the assessment. And if you're someone that loves where you're working and things are going well, or you've just landed this new opportunity and you've been able to really change your own trajectory, and you now want to enhance your performance and really be a top performer, or you want to really start thinking about laying the groundwork so you can have this amazing rock star career, then again, you need to go to evolveyoursuccess.com. Right there on the homepage, select Improve Sales Performance and have a conversation with one of us from Evolve Your Success to talk about how we can literally evolve your success and give you the best 2021 year you can deliver for your career and for your company. As always, I love bringing guests so that you can learn new insights around what happens in the medical sales industry, whether it be in a field that you know very well or in a field you've never heard of. And of course, as we grow, we're getting in touch with more and more people from all reaches within medical sales, and we're connecting leaders to leaders, companies to companies. So if you're a company that's looking to, maybe you have a product that you want to get out there, or maybe you have an opportunity that you need certain people to hear, again, visit us, evolveyoursuccess.com. You can find me on LinkedIn, Samuel at evolveyoursuccess.com. You can send me an email and let's have a conversation and let's make this year, 2021, your most amazing year. I wanted to say I'd like to consider this the comeback year, right? Because 2020 was such a setback for so many people. But let's take it one step further. This isn't the comeback year, 2021. This is the going beyond all achievements you have experienced up until now year. That's what 2021 is. You're going to blow it away this year. You're going to do things that you've never done before. You're going to take your career, your life to new heights that you never reached before. And we want to be a part of it if we can. So again, continue to listen to the Medical Sales Podcast. Visit evolveyoursuccess.com if someone that wants to get into a role, improve your role, or get connected to other leaders and other companies. And I hope to hear from you. Actually, I won't be hearing from you, right? You'll be hearing from me. I hope that you tune in again next week to listen to another episode of the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry, become a top performing medical sales professional, and also how to masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.